All right, so we just talked about the two-handed tie. The next one we're going to talk about is the one-handed tie, and we'll talk about both tying with your left and your right hand. So this is more common when you're doing a perineal repair. It's just a little bit easier to do one-handed just due to the space that you have compared to the two-handed. So once again, going from a right-handed perspective, so you have your needle and your needle driver. You're going to throw your first stitch. The needle will end up over on the left side. And then you have your needle driver over on your needle. Now, it's the easiest thing to do is to once again cross it just like you would for your two-handed. And then once again, it depends on whether you cross the needle over or under your tail string. So since we went over our tail string, we're going to start, you might hear it called the karate chop, where you have it over your three fingers like this. You bring the string with the needle on it and your needle driver over. You have your middle finger come grab the tail, pull it through, and lay it down flat like that. So we did our karate chop first. The other move is what you might hear it called the C. So you have the string in between your thumb and forefinger, and you bring the string with the needle and needle driver in the middle. You have your index finger come through, grab the tail, then you rotate a little bit, and it should look like that. Now we just did our C, so we do our karate chop again. And the thing that I like about this is if you grab it like this, then you don't have to readjust the tail in your hand. So you just have your tail hanging over your three fingers. You bring the needle with the needle driver string over your middle finger. Middle finger comes through, grabs it. Once again, it's important to put the same amount of tension on each side so that your knot lays down flat like that. So we just did the karate chop, so we're back to the C. So we have it over our thumb and forefinger. We bring the needle with the needle driver in the middle there, and with our index finger come through, grab it, and then rotate to where you have the same tension there. We go back to our karate chop. We bring it over our three fingers, take our middle finger, grab the string, and pull it down flat like that. So that's probably the most common way that you're going to do it, because you're usually throwing it with your right hand over to the left, and then you cross. I'll do one other quick example of if we were crossing, when we do our initial cross, whether we would go over versus under. So same thing, you have your needle in your right hand, you throw. This time, instead of going over, you're gonna come under, and then so instead of starting with the karate chop like this, you're gonna start with the C. So since your needle with needle driver is under, you have your tail over your thumb and forefinger on your left. You bring it to the middle, bring your index finger through, pull it down like that. And since you grab it like this, you're already in position to do the karate chop. You bring it over your three fingers, grab your middle finger through, pull it straight down like that. You do the C again between the index and thumb finger, or between the index finger and the thumb, pull it down, get it flat. And then for one more time, you do the karate chop. So you have it over your four fingers, bring the needle with the needle driver over the three fingers, come through with your middle, grab that, rotate, and then you have your knots laying flat like that. So that is tying one-handed with your left hand. We'll stop this video and then go through tying one hand with your right hand next.